Can you please introduce yourself?
My name is Jogie Enguito.
How old are you, Jogie?
I'm fine, ma'am.
And how old are you?
I'm 32 years old, ma'am.
32. Are you married?
No, I'm single.
Okay. Do you have children?
No, ma'am.
Okay. What can you tell me about your educational background?
I finished my college course. I finished a Bachelor of Science in Nursing.
Okay. And now describe me a little bit your working experience.
I worked before as a nursing aide here in Philippines. And then I am the one who take good care of the patients, taking vital signs, give medicine, and then I am the one who feed the patient, grooming, and make them tidy. And then I also work as a nurse phlebotomist here in Philippines also. I am the one who extracting blood and then preparing for the samples like urine and the stool. And then 1 year ago, I worked as a private nurse in Doha, Qatar. I am the one who give medicine to the patient. I am the one who assists the patient. I am the one who care of the patient and then give the food like feeding, grooming, and then I am the one also who accompanied to the patient if there is a therapy. Like for example, when she go to the other country like Germany or in United Kingdom. So I am the one who accompanied with her.
Okay. So let's take your first experience in Philippines. You said you work in a hospital
Yes, ma'am, as a volunteer nursing aide.
as a volunteer. For how long?
That one is almost maybe almost 1 year, and then I also work as a nursing aide in clinic for 1 year also.
Okay. What age, how old were your patients?
My patient,
Yes.
she is 72 years old.
How old? Sorry.
72, mom.
70.
72 years old.
When you were a nurse, right?
Yeah, I am a nurse, but under board without license.
Okay, but didn't you work with more types of people? With just only with one? You took care only of one?
No, no, different kinds of people, mom.
And what age were the
Toddler,
people?
children, newborn, and then toddler, preschool, and
Okay.
then adult.
Okay, and you only assisted them to the medical part, or did you also, for example, change the diapers for small children, feed
Every,
them?
everything, mom.
Yes. Okay, and in Doha you were a caregiver,
Yes, ma'am.
and therefore how long did you stay?
I finished my 2 years contract, more than 2 years.
Okay, and why didn't you renew your contract?
Because I want to experience another country also.
Okay. How was your relation with your former employers until now?
We are fine, ma'am. She wants me to come back in Doha, but she sent me a visa, but I refuse because I want to try another one, another area.
Okay. What kind of job would you like to find in Romania?
If there is a caregiver, ma'am, it's better.
Would you prefer caregiver to take care of old persons?
Yeah,
Why?
old person, if there is old person or baby which is available.
But why would you prefer to be caregiver and not nanny, for example?
I would like to be a caregiver so that I can, because that is related to my work, related to my studies, so that I can I can render my knowledge to that person.
Okay. Would you like to work also as a nanny?
Yes, I will.
Yes. Okay. Tell me, when do you introduce the solid food to a child?
When 6 years, 6 months.
Okay. And what kind of food do you start to give?
Uh, veg, fish, and nutritious food, mom.
Okay, maybe mashed potatoes
Sir,
or
yeah.
okay. When do you start to give the child food? Meat, sorry.
6 months, mom.
6 months. What kind of meat do you give to the child at 6 months?
Which is grinded, yeah, blended because they don't have teeth.
And
So it's
what kind?
difficult for
What kind of meat?
chicken,
Okay.
beef.
You give beef and chicken to a child of 6 months. Okay. What would you do if the child you are taking care of is starting to cry without a break?
I talk to the child, and then I will hug him or her, and then I will explain to her. I will ask her why, what's wrong, and then I will give comfort. And
And
then later on, I will make some play together with him or with her so that the attention is convert.
but what if the child is 3 months old?
If 3 months old, maybe she feel hungry, so I will give something to eat, something to feed,
Okay, what else?
or I let the child carry. Maybe they need some comfort, or maybe the diaper is wet or too much urine or something, so I need to change. I will check everything.
Okay, good. What if the child you are taking care of is getting sick?
When the child is getting sick, so I will at first if the child experiences fever, so I will give tepid sponge bath to reduce the heat of the child,
Okay.
and then I give the medicine, and then if that sick is not any no progress, so we will refer to the physician for checkup.
Okay. And what step is informing the employer about the sickness? When do you inform the parents?
When the sickness is started, mom.
Okay, so first you inform the parents.
Yes, mom.
Very well. Um, what if you are dealing with naughty child? How do you proceed? For example, it's lunchtime and the child you are taking care of doesn't want to eat. How do you convince him?
I'll make some joke or something that divert her attention. I make some different different ways of to catch his or her attention. Maybe we will play together or anything, mom.
Okay. Can you tell me what kind of educational activities would you have in your daily schedule? For example,
Educational.
yes, for example, you take care of a 2 years old child. What would you teach him?
Coloring,
Okay.
reading, like for example ABCD because that is the basic one.
Okay.
Then counting numbers.
Okay, good. Do you know any songs or any stories for children?
Like for example Cinderella, the Snow White,
Good.
Sleeping Beauty. Yes.
This is good. What kind of games would you play with the child?
Playing with balls and then puzzle.
Okay. For example, if he will be offered you a job as a nanny and besides taking care of the child, you will have to do also the household chores. Do you think you can manage?
Yeah, I will.
Yes. You know how to iron?
Yes, I will.
But do you know how to iron clothes?
Yes, I know, mom.
Yes, including office shirts or uniforms?
Yes, mom, I can.
Yes. What about cooking?
I don't really know how to cook, but I will try. Maybe because because that is the food there is different compared to the food here in Philippines, right?
Of course, yes, it is.
Yeah,
But
it will give me maybe a recipe, something, and there is a guide that you need to do like this, like that. So yes, of course I can because I read the instruction. I can able to read the instruction and understand.
but are you are you cooking there in your house?
Yeah, yeah,
So you know how to cook Filipino dishes.
yes, I will. I will. Yeah, yeah.
Okay. What is your family saying about your decision to leave?
Um,
Do you hear
yeah,
me?
because they know that,
Hello?
ma. Yes, mom.
Okay, now I hear you. Can you tell me what is your family saying?
Yeah, they depends upon my decision, ma'am. If I will go to abroad, it depends upon me because they will not force me to go abroad. Yeah, it depends upon my decision. If I'm willing to work abroad, they will support on me.
Okay. How would you like to spend your day off?
Just to save my money for my future family soon.
I didn't understand how would you spend your day off?
My bills.
Yes, how would you spend it? What would you like to do in your day off? In your
My
free
day
day?
off to praise and worship with God, and then bonding with my friends as well,
Do you have
if
friends in
ever.
Romania?
If ever, mom, if there is, yeah.
Okay. For how long would you like to stay and work in Romania?
To finish my contract, and then if my employer wants me, maybe I will renew. It depends upon.
Okay. Uh, uh, have you ever been abused or mistreated?
No.
No? Okay. Thank you so much for coming.